Hello, Bill Sell here with the Bio Video Show Daily, and my guest, Peg Willingham, with the Bio Ventures for Global Health organization. Talk a little bit about your mission.
I'll be glad to. Thanks, Bill. Well, everyone knows what the biotech industry organization is, but what I think a lot of people don't know is that Bio helped to found several years ago a nonprofit organization to try and get the benefits of biotechnology out there to poor countries who want to benefit from the new drugs, vaccines, and diagnostics that Bio members are working on.
And in terms of the mission here, it's really to bring people together, both on the financial side, but also the companies that are doing the R&D, and making sure that all this the R&D and the intellectual property really get used.
Exactly, and partnering is what it's all about, because there are people in developing countries who want to benefit from these medicines, they want to do the research, and they want to work with biotech companies. And as you know, there are people from all over the world here at this conference, so it just shows what's being done that could really be harnessed to benefit more and more people.
And BioVentures does some research and actually issues some reports on things. What is some of the latest information coming out?
Well, we have a new report that talks exactly about the role of biotech in neglected disease research, and it turns out there are 134 biotech companies, small and medium size, who are involved in neglected disease research. So we're talking about vaccines, drugs, and diagnostics for things like malaria, tuberculosis, dengue fever, and other neglected diseases. So it's really exciting. And in fact, about 39% of all global health neglected disease projects have biotech partners. So that's the good news. Now, as you know, though, 134 is only about 5% of all biotech companies. And the overwhelming majority of biotech companies work on health, about 90%. So our goal with this report is to let people know the good news. There are biotech companies trying to solve problems for the world's poorest people, but we'd love to have more partners in the game. And what they need is incentives and other stakeholders to help them get into it, to learn, first of all, what are the problems, what is the pipeline, what's the science out there, and to demystify the process so that people realize, you know what, we have a molecule or we have a product that might work for these other diseases.
So it's easy actually to get in touch with the organization. They should just reach out to you guys.
Absolutely, at www.bvgh.org.
That's very straightforward. Anything else going on at this point that you're going to talk about in the industry?
Sure. Another hat that I wear is there's a great nonprofit organization that is trying to raise awareness here in the U.S. about the need for new vaccines, the kind of vaccines that Bio members are making, and it's called Shot at Life. And the goal there is to get people to realize that there are more than 1 million kids who die every year just because they don't have access to vaccines. Those vaccines exist, and there are new vaccines being worked on for things like dengue or malaria. And so, again, it's all about bringing the innovation that we're seeing here at Bio to people all over the world. Only about 10 million kids a year are born in rich countries compared to 120 million in all the rest of the world. And so what we're trying to do is save their lives, as well as bringing the innovation to the kids who already enjoy it in the U.S. and Europe.
So one or two small steps in breakthrough really could make a huge difference with those numbers.
That's absolutely right. We really are on the cusp of saving a lot of lives if we can just get this innovation out there to the people.
Well, thank you very much for joining me today, Peg, and joining us here today on the Bio Video Show Daily.